everyone. I'm Reena, a journalist and founder of Good Trouble Productions. Welcome to the NV Summit. This particular panel is looking at access and crisis management. How do you plan and execute during a crisis, especially during this time of COVID? We've got a great panel. I want to get right to it and introduce them to you. We've got Dr. Ashley Joseph, who's a pediatrician and pediatric anesthesiologist at UT Southwestern Medical Center, who joins us now. And actually, I want to start with you, Ashley. In this year, what has really been the most helpful thing for you for finding resilience?
Yeah, so this year's been really hard mentally, spiritually, emotionally, physically. I think historically for me, in times of chaos, I lean into what I know to be constants. And for me, especially this year, it's really been faith and family. I've honestly been really leaning into the word a lot more this year than in prior years when I wasn't so troubled. And, focusing on my family and the health of my family has really been my top priority.
When you say you're leaning into the word, is there anything in particular that you felt like maybe a year ago you didn't do that has made a difference for you?
I just think when things are good, I tend to not be so devoted to the word and not so devoted to my walk with Jesus Christ. And I think in times when I feel alone and I feel stressed and anxious and overwhelmed, the entire last 9 months, the only thing that has given me peace is prayer and the word.
Yeah, that's so powerful. And I feel like people don't say that nearly enough. It's given so many people such strength. So thank you, Ashley. I want to turn to our next panelist, Alvin John, who's got a fascinating career as well. Deputy Political and Economic Chief at the U.S. State Department. Alvin, thank you very much for joining us. I want to ask you the same question I asked Ashley. What's really been the most helpful thing for you in finding resilience?
Thank you so much, Reena. And what an honor it is to be a part of this panel. So for this year, when it started, if you had told me that we would be dealing with this, I would have given you $1 million because there's no way anybody could have predicted it. So as the Deputy Econ Chief, one of my portfolios is to gather information on the health situation in our area. So we started looking at COVID from the beginning, and it was quite shocking. And one of the main things that happened at the beginning is the State Department gave us an option, saying, look, Mexico is going in the wrong direction with COVID. So we can give you a chance. You can go back to your hometown and work from home. And so to your question, I think one of the biggest things and what a blessing it has been. So I actually just came back to the region. So the past 7 months, I've been in Dallas, close to family and close to our home church. And as Ashley mentioned, I would say the number one thing has been faith and family. And so, leading into the word, praying a lot more, having a routine where you're seeking God from a place of humbleness and understanding that you're not in control. I think for all of us as professionals, we like to control our environment. We want to know, what's going to happen next. But what COVID has shown us is that we are not in control. And there's only one who is in control, and that's God. And he has the world in his hands. And to understand that, it really humbled me this year because as part of my job, COVID was number one on my portfolio. So literally having to report to Washington every single morning on the deaths, on the hospital situations, on the pain of COVID for the entire region. It was quite overwhelming for me and for my family as well, knowing many of our friends and families who've gone through it. So leaning on God was, I would say, the number one thing.
Mm-hmm. Thank you very much, Alvin. I want to get a little bit into your career as well in a little bit as we go around the horn and sort of introduce everyone. Next, I want to turn to Jacqueline Marciante, who is a co-owner of Marciante and Company. Jackie, if you could first sort of tell us a little bit about your company and what's really helped you in this past year?
Yes, so thank you so much for having me on this panel. Marciante and Company and Mission Leather Co. is two brands that my husband and I run. And, for us, a lot of people have assumed, since we're an online business, that we weren't going to be affected by this year. However, like we do a lot of our own manufacturing and all of our order fulfillment in-house. So in our facility, if we would have been closed, we wouldn't have been able to operate at all. But to answer your question, thankfully, we were able to pivot pretty early on and adjust some things within our business and find a way to continue operating even during the shutdown. So that's like really just the business side of it. But from the other answers, my husband and I have been just relying on God and praying every day. And throughout this journey, like our support system has helped us as well. And we've just been taking it day by day.
That's really great. And it's great to hear everyone say how much prayer has really made a big difference. I want to turn to our last panelist, Justin Jacob, who has such a fascinating career. Boy, supervisory chemist and chemical terrorism coordinator for DC's Department of Forensic Science, the Public Health Lab Division. Justin, what does that mean?
Hi, yes. So it was supposed to mean exactly what it means, but it turned out that my job actually kind of changed and evolved in real time because of this COVID response situation. So I work in the DC Public Health Lab Division, and I was promoted to a middle manager back in March, and then the pandemic response happened, and where our lab was very heavily invested in the testing for COVID-19. And because of just kind of like how things worked out, that ended up actually being my primary role, was responding to help with the testing. And basically, to answer your question, like I think the two major things that I think that helped with with resilience for me is family and our teamwork. That like just the team members that we had, we really as a team, we each uplifted each other. And when someone was really like having a rough day or a tough day, there were other people that helped fill that void, to help pull each other across the finish line. Because at the end of the day, that's what we are trying to do. We're one big team, and I really got to meet and work with so many different people that I would not have been able to have the opportunity to do with my other position, with my actual position, as you mentioned, as a supervisory chemist. So now I'm starting to get into that role, and it involves it's a supervisory role. So we look at different things on the chemistry side, whether if there are certain exposures that people may have to whatever it may be. We also look at drugs. We look at needles from syringe programs, replacements programs, just to see what kind of, just for surveillance purposes only, to see what types of new drugs may be circulating in the district. But that's kind of in a nutshell what I do. But I think like I said, to answer your question, family and teamwork really is what helped me personally get through this.
That's so great to hear. Justin, I'm curious, you work in a lab. What changes have you seen in the past year under COVID?
So I've worked in a lab for the last 12 plus years, and this is the first time that I've ever been deployed into the field to do stuff, so one of my biggest responsibilities was coordinating a group of contractors and other employees to do mobile testing in our mobile testing unit. And basically the Centers for Disease Control, they basically loaned us a big mobile lab, like a 40-footer mobile lab that we drove to different places around the district to do testing, to do on-site testing of people, vulnerable populations. So people maybe at homeless shelters, long-term care facilities, and that kind of thing. So this is the first time that I'm actually I'm walking into these places where patients are, and I've never really done that before. It's always been in a lab bench, or on a lab bench, or like in a biosafety cabinet hood, those types of things. So this was the first time I'm actually really getting that public facing experience it's been a really, really life-changing one.
I bet. I mean, especially testing, it's a crucial component right now, and one that people feel we haven't fully been up to speed on. This panel is sort of looking at assessing, planning, and executing in the midst of crisis management. And Ashley, I think you're coming to us from the hospital. Are you at the hospital right now?
Oh no.
Oh, okay.
Like the office area of my apartment.
Office space. I was like, wait.
A lot nicer than my apartment. So I thought I'd.
Oh, I was like, wow, is she coming to us right from there? I was like, she's very dedicated. Ashley, you're actually in the epicenter as a doctor, and how you deal with crisis management is so crucial. How do you not let your fears paralyze you when you're in that critical moment?
I think in the beginning of all this, they really did. My husband's also a physician. He works on the adult side. I work on the pediatric side. We have a son, and one of the things that really hit us in the beginning when there were so many unknowns and we weren't sure how, getting COVID at our age would affect us. Like, is this going to be fatal? Are we going to have long-term consequences? It was really overwhelming to think if both me and my husband get sick, like what will happen to our son, right? And in the beginning, I was like refreshing the numbers hourly, just seeing like the rate of rise in Dallas. And it is probably the most anxious I have ever felt in my life.
And for good reason.
And for good reason. But, as I was saying before, whenever I feel overwhelmed, faith, family, but also, like very practical things like daily exercise, daily meditation, just getting my headspace a little more clear and a little more focused allowed me to actually start planning. So then my husband and I came up with a plan. If we both get sick, we're going to send our son to my in-laws or my sister in Philadelphia, et cetera, et cetera. I think the other thing is, most people that go into medicine, there is a heart that drives you to go into medicine. You want to help people, right? And so as much anxiety as I was feeling, I also felt like, okay, this is it. This is like what we signed up for, right? This is our war. Let's do this. So the contrasting feeling of anxiety was not excitement. I don't think that's the right term, but like I signed up to help take care of patients. My husband signed up to help take care of patients. That's why we became doctors. And so that is what we do. This is my duty. This is my job. It's time to execute. Sorry, I don't know if that answers the question.
That's a great way. But I'm also wondering, there must be moments of sort of fear, maybe even doubt, like, am I doing the right thing? How do I work past this moment? What's helped you when you're executing during a crisis? How do you not let yourself get paralyzed?
I think refocusing on my why. Why am I here? Why am I doing this? Like, what is my purpose in all of this? And if my purpose is really to help take care of patients, then a lot of the fears go to the wayside or they don't become as important. I'll say one of the biggest issues is, I'm an anesthesiologist and we are oftentimes in charge of intubating the patient, and the way they talk about it is that's the most aerosolizing procedure. So if a patient is infected, that's the most viral spread you're going to get is when you're actually putting the breathing tube in. So, me and my coworkers, all of us were very, very worried about we're going to be exposed on a regular basis. Do we have proper protective equipment? In the beginning, we really didn't. But I think there was just something, in the back of my mind always saying like, this is what we're here to do. And if this is what we're here to do, to take care of the patient, we take care of the patient and worry about the other stuff later. And I honestly think that was like one of the few things that helped me get over the anxiety.
Wow. I had no idea. I mean, it makes sense now, but intubating is one of the largest, you said sprays through the viral load.
Yeah. It aerosolizes the virus basically.
Wow. It makes sense now that you mentioned it, but I had never thought of it that way. Jackie, I want to turn to you, when you're talking about crisis situation and dealing with this, how has building your company helped in creating sort of that resilience?
Yeah, with this year, I feel like in two major ways. the shutdown of non-essential businesses meant that we had to close our facility unless we found a way to be considered essential, which is what we did and how we pivoted to start making masks. We're in Dallas, so Dallas had a shelter in place for all non-essential businesses. My husband and I, we already had the equipment, the materials, and basic infrastructure to start making masks, and we saw that opportunity. So we had a conversation at the end of March and thought, why not? Why not do this to help the community? It also killed two birds with one stone for us. We were able to help the community and give back in a positive way during the chaos that was the beginning of the pandemic. We were also allowed to keep our business operational after being considered essential because we were making masks at the time, and we could continue shipping our other products as well.
Oh, that's so fascinating how making masks kind of helped your company in a way, and you helped the community. I like that, two birds with one stone. Elvin, I want to talk a little bit more about your career at the State Department. When you talk about risk management, tell me a little bit more about the other places you've served. And when you go into a crisis, how do you evaluate and determine, how do you make a plan?
Thanks, Reena. So interestingly, right before I came to Mexico and to take this position, I worked for the secretary in what we call in the State Department, the Operations Center. Maybe you've probably heard of it. It's basically the crisis management center for the entire State Department. And I don't want to scare anyone here, but I can tell you by working there, I can tell you the world is like a balloon waiting to be blown up, literally by a pin, because there's a crisis happening somewhere in the world at all times. And the number one mission of the Operations Center is to help Americans who are stuck abroad in a crisis. So as you can imagine, every time I'd go to work, so we do 12-hour shifts, and we're basically watching the world for the next crisis. And we have to update the president, the vice president, the secretary at all times on what's going to happen next. And we're literally on the front lines of information, and we have to give the right information to obviously the most powerful people in the world to make the right decisions. To one, make sure that America is safe, and number two, to make sure that Americans are safe abroad. So this whole COVID crisis really was kind of a real action plan for the experience that I had in the Operations Center, because we dealt with crisis every single day. And to your question, I think the best thing to think about dealing with crisis is really preparation. If you don't practice and if you don't prepare, you're going to be flat-footed. And we've seen that throughout. So for example, we know there's a hurricane season every year. We know Americans get stranded every year. So we literally in the State Department do exercises way before that, where we do exercises on, okay, how are we going to get 10,000 people from the middle of the Caribbean back to the United States? Or for example, if a war breaks out, and as in the last 2 years when I was working in the State Department, in the Operations Center, definitely war broke out in several places. And we have literally Americans calling and saying, hey, how do we get back to America? And even during COVID, the State Department ran hundreds of flights. I'm sure you guys have all heard of it, but this Operations Center was in the middle of that. They literally brought back thousands of Americans, from these COVID areas when all flights were stopped. So the number one thing is preparation. You have to prepare and to understand, okay, in a crisis, what am I going to do? What am I going to do with my family? What am I going to do with finances? I mean, as Jackie mentioned, it's not just about keeping your family safe. You also have to worry about your finances, your health. There's so many aspects of it. But I think to an individual level, I think the number one thing is preparation.
That's fascinating to hear. I want to turn now to Justin. Justin, testing has been such an issue for so many people. When you look at it right now from your vantage point from DC, what do you think when you're looking at the crisis situation and over the next few months, what's your biggest concern in assessing sort of the risk and where we move forward on testing?
I don't know how to directly answer that question. I think that it's kind of I guess for us in particular, I think in our lab, like what we try to do is I want to echo what Elvin was saying earlier. We want to make sure that everyone in our lab is as prepared as possible to do the tasks that they need to do. And we also want to make sure that we are also preparing people to be adaptable to whenever like the situation may change just a little bit. Like I'm not going to give too many details, but based on what our group deployed into the field yesterday, and we discovered something, and based on how a person tested positive, and that helped. That was the first time in that specific context, without revealing too much information, where we realized that maybe there's a different strategy that we should probably assess, or reassess how we do or who to prioritize with when it comes to testing in the field, because we are lab people. We don't really. This is the first time we are doing something like this for me specifically, but even like a lot of the contractors that come out with me, some of them are right after they're just graduated from their undergraduate degree, and like I like to take these types of like these moments to kind of be as best as I can to train them and mentor them, so that way they end up, like they don't end up being demoralized by the pressure or by the amount of work, because I don't want any of the people that work with me to feel like they're being thrown into the fire. So I like to, I don't know if it's an indirect way of me. I don't know if I'm fully directly answering your question, but I kind of, I don't know. Yeah.
That's a great answer. So it's interesting. I'm hearing from so many people, from so many of you guys, the importance of preparation, even if that might not meet when you go into battle. It might fall apart, but having some sort of plan, and then also being able to pivot. As you mentioned, Justin, you were not out in the field before, and all of a sudden you find yourself in a different position. Jackie, when you talk about resilience, also from a medical Ashley, from a medical standpoint, what do you think people need to remember in the year that's to come? It's been a remarkable year, this past year, for so many people shut in and businesses not able to do what they're supposed to do. But what do you think from a medical standpoint we need to keep in mind as we move into this new year?
I think, the vaccine is here on the horizon. So for me, it's like Christmas miracle, right? I think it's something to get excited about. I very nonpartisanly will be, advocate for it everywhere I go. I am optimistic. I'm very optimistic, actually, that a year from now, we will be in a very different situation. But I also think, it's going to take time for this to be effective, and we need to stay vigilant in that period. Masks on, stay socially distanced, but be optimistic that the light at the end of the tunnel is here.
That's great advice. I want to start with you again, Ashley, and just go around. We've got just a couple more minutes left, but this panel was about assessment and crisis management, but I want to actually end with resilience. What's been a good example of resilience, and how have you been able to find resilience? And we'll just go around. I think we'll go from Ashley to Elvin to Jackie to Justin.
Oh gosh, that's tough. Can I defer and come back to
you? Yeah, absolutely.
Okay,
why don't we head to Jackie?
For us, I think it's just the ability to be flexible, adapt, and adjust quickly to change, whether it's positive or not. I think as leaders, don't be afraid or too prideful to change. That's how you continue to grow, learn, and get uncomfortable. For a startup, especially with us, things change pretty quickly, so be willing to adapt. There's opportunity all around us to be creative, think outside the box and embrace different perspectives, because I think that not only helps you in your own workspace, it also grows you as a person in general. So for us, like in the fashion industry, in our line of work, when we started having issues pretty early on with our factory, because we source some of our leather and products in Leon, Mexico, we then realized we can't put all of our eggs in one basket. Because if your factory has a delay with your inventory, that means you're not getting anything on time. Instead, we did some research, visited a few other factories, built relationship, shifted our styles into other places. And that meant if there was a delay at one factory, it didn't mean we were delayed on every single product. Mm-hmm. So all that to say, like, I think you have to move quickly, especially in our type of environment. We can't be stuck in a rut when things don't pan out exactly how you want it to be. And I think it's just, don't be afraid of change and be willing to move things around. Yeah. I think panic and worry slow you down, but I think it's also important to embrace like your feelings, and feel those feelings, but at the same time, find the solution that works for you to move forward.
Good advice. We've only got about a minute left, Elvin. I want to turn to you and Justin and Ashley as well.
Sure. Since we're short on time, I look at resilience as an elastic, as a rubber band. If you want to look at it, in your life, you're going to be stretched. You're going to be pulled, and the more dense you are, the more you can handle that stress that's going to be put on your life, and the real foundation, the real density you can get in that elasticity is from faith in God. And that's really been the resilience that I've seen in not only my life, but in the lives that we have on this panel is, let God be that density in your life. Let him be the center. Then it doesn't matter. You can be pulled and stretched anywhere you want, but you will always come back to that center.
Elvin? Excuse me, Justin, we just had Elvin. It was great.
Oh, sorry. Yeah. I think maybe in a couple words, sleep, rest, and relaxation. I think that was a big thing for me. So it really helped me be ready to just go out the next day. So.
That's great. And we'll wrap it up with Ashley.
So I think biggest things were just getting uncomfortable with being constantly uncomfortable, letting go of the facade that I was in control of anything. That's one of the biggest takeaways of this year, being flexible and staying optimistic, right? So though the sorrow may last through the night, joy comes in the morning, and hopefully that joy is coming soon.
That is a beautiful way to end it. Ashley, Elvin, Jackie, and Justin, I want to thank you all for joining us on this panel.